Hypophosphatemia is usually caused by either renal wasting of phosphate or actually overuse of antacids. Remember, calcium likes phosphate, and if you have hypercalcemia, then you're going to have increased binding of your phosphate. These patients are oftentimes completely asymptomatic, although they will occasionally present with weakness as well as bone pain. Remember, calcium phosphate. Very rarely some degree of rhabdomyolysis. Diagnosis is going to be serum labs, and your management is going to be either IV or PO phosphate repletion. Remember that we do have a potassium phosphate formulation available to us, so if your patient is both low in phosphate and potassium, that is an option, but it is a very prolonged infusion, a minimum of 6 hours. So just simply judge accordingly.